In 2016, our community began the difficult conversation of examining the impact of mental health issues and access in Springfield. Led by the Healthy Living Alliance, the Springfield-Greene County Health Department has been overseeing an 18-month assessment that has met with stakeholders, focus groups, done analysis, analyzed trends, and presented to numerous community groups, all in an effort to garner the best understanding possible of the mental health landscape in Springfield. Our next panel is here today to discuss some of the broad themes that have emerged in this study. I'm going to please join me in welcoming Katie Towns. She is the Assistant Director of the Springfield-Greene County Health Department, and she will serve as our moderator and introduce the other members of our esteemed panel. So this afternoon, please welcome, ladies and gentlemen, Katie Towns.
Hello. Well, thank you so much for having us. I'm extremely privileged to be here today and to have these amazing partners to join us on this panel. We at the Health Department have been working with CJ Davis, who is the CEO and President of Burrell Behavioral Health, with Mercy, and Dr. Kyle John is here to represent Mercy. He is a child psychiatrist, and we have Steve Edwards, who is the CEO and President of CoxHealth. So a little bit to just sort of orient us to this topic of mental health. We have been talking about mental health at the Health Department for the past couple of years, and that really started when in 2016, these partners, as well as many others, came together and we identified health priorities for our community. And we did that through a collective process of looking at data, but also the feasibility to tackle some hard issues in our community. And mental health rose to the top because we kept hearing feedback from these partners about how mental health was really affecting healthcare in a variety of different ways. So we began sort of evaluating the issue, and we then went after some funding to seek expertise to help guide us through a process on how we were going to localize mental health and really start to uncover how Springfield as a community could improve the mental wellness for individuals as well as our systems and policies that help us to create mental wellness in our community. So when we did that, Missouri Foundation for Health was very generous in providing us with about $250,000 to do just that. And we began analyzing the data, and we started uncovering some really interesting things. Some of the things that started to provoke the conversation were the fact that there wasn't a common set of language even amongst providers on how we could analyze and track and measure improvements. And so we started to look at ways that we could look at mental health through a lens of understanding and really providing context for us to collectively focus and move forward and improve. And then we started to look at some of the individual stories that resonated with our community. And we heard some tragedies, and we heard some things that were really positive. And so we were able to move forward, and we are almost to about the end of this assessment. It's taken about 14 months for us to get to a place where we're going to now be able to share with the community what all we have learned, as well as start to develop a plan for improving and really moving the marble to help us improve mental health in our community. Just to share with you a couple of things that we have learned along the way that have been extremely sort of alarming but also eye-opening as to opportunities that we can move the needle. 1 in 5 adults in the U.S. has experienced a mental health issue in this year alone. Well, we'll use 2018 as a level set, but the prevalence rate is large. And so we know that this is an issue that is affecting anybody that might be in a place where you might be sitting next to somebody at work. You might be sitting next to somebody in your church, or your child might have a mental health issue emerging. And we also learned that more than 50% of people don't seek help for those things because maybe there are barriers to access, there may be barriers that stigma creates, there may be things that they just don't even know could be mental illness and they need to seek care. And then finally, we also learned that more than half of mental health conditions emerge by the time somebody is 14 years of age. So we know that these things are happening in our children's lives. And so that's really important. And it's important for us to learn how we can get them access so that they can have the resources and tools that they need to navigate a mental illness. So as we begin, I do want to just sort of pause and take a moment to say, too, that this issue, I'm so privileged to be able to speak to this, and I'm so thankful for 417 allowing time to speak to this issue because it's one that is challenging, it's often uncomfortable, and I would hope that today we would be able to provide a different perspective, a new lens on how you might look at mental health and mental illness, but also to offer hope because there's so much good that's going on in our community, and there's a lot of new things that you might not realize that we can offer here today. So with that, I will go ahead and start with you, Steve. And if you wouldn't mind, just starting with sharing your perspective on mental health and why it has become a priority for CoxHealth this year.
Well, you know, I'm a layman in many ways. I'm better at spreadsheets than medical things. But in layman term, when I think of most of the medical issues that we encounter, it simply has to do with fluids, the regulation, management of fluids, and the chemistry associated with it. And so when I think of maybe a pancreas that's dysfunctional, insulin's not being produced, and because of that, then we can't convert sugars into energy, and it's lethal, and we can manage that with insulin. Or if your kidney, which controls so much of your fluids and the chemistry in your body, if it's not functioning, it's lethal, and we can do things. We can do powerful things, and people are empathetic and compassionate to that. If someone has diabetes, there's powerful support and resources for those people. If someone has kidney failure, there are people who will donate their kidney to save their life, even strangers. If you have problems with your brain chemistry, mental illness is associated with that, we discredit those people, we discount those people, we minimize those people. It's worse than the opposite of empathy. It's worse than indifference. Right. And so the problems are really powerful, I think, because of that, that sense of almost stigma. In the United States right now, our suicide rate is increasing. It's materially higher than the rest of the Western world. The rest of the Western world, the suicide rate's going down. Mm-hmm. Missouri rates are higher materially than the United States, and Greene County is higher than Missouri. If you're a 14-year-old girl, the chance of you committing suicide are 40% higher than they were 2 decades ago. We have an opioid crisis, and we've talked a lot about that. 70,000 people dying a year with overdoses, 49,000 of those opioid-related. And it's very scary. And the resources in Missouri are being reduced. We had 4,500 inpatient beds in 1990 in Missouri associated with inpatient psych. We're now down to 2,000. And as of February 9, we'll have 100 less because another hospital is closing in the Kansas City area. Those all are things that could cause despair. But there are 5 things that give me hope, really 5 people that give me hope that I see around me that are making a difference. And Katie, one is you. The Greene County Health Department, Clay Goddard and others, who are continually bringing a face and a voice to this issue. And I've been personally impacted by what you've done because that voice leads to understanding, understanding leads to compassion, and that leads to action. Brooks Miller at Jordan Valley has gone beyond his mission of primary care with some criticisms to work in the mental health arena. And I'm proud of him for doing that because he's taking care of the most vulnerable patients in our community. And so what Jordan Valley is doing offers much hope. In my organization, Dana Harbin's a very quiet leader that few people know, and she is changing our organization with her commitment to mental health. We're one of the few hospitals in the state that's actually added beds despite very poor business reasons, but it's the right thing to do, and that's because of the singular voice of one passionate person who's leading our efforts in Dana Harbin. Another one is CJ to my left. Before CJ came to Burrell, a 14-year-old adolescent girl that's got suicide ideation, the typical appointment time was at least 4 months and often 7, 8, or 9 months with suicide ideation. CJ and his team are there now, and that same patient can get in today. And that's emblematic of the huge difference that Burrell is doing for access in our community, and I'm really proud of that. And then the last group I want to recognize is the people that give the care, because they're on the front lines. And these are compassionate, caring people. And we know that in healthcare, it's the most dangerous job in the United States. We know that 2/3 of all workplace violence happens in healthcare. And 81% of the workforce are women. That means 2/3 of violence in healthcare. And so it's affecting women. So those are heroic people that are making a difference. They give me great hope.
Absolutely. Thank you that's an excellent recap. And it does remind us that these issues are challenging, but there are so many people in our community, and we are really fortunate to have all of those excellent resources.
Collaborating.
And the collaboration, absolutely. And it sort of dovetails nicely into Kyle talking about how we have an excellent example within the last couple of weeks that there was a Wall Street Journal article about how Mercy is integrating virtual visits into options for primary care visits with children. And one of the things that we have continued to see through the process of this assessment is how many barriers there are in the sense of shortages. And so access can sometimes become an issue because providers are often overwhelmed with the caseloads that they could manage. And so this idea of virtual care really provides the access issue to a sort of different approach. And so if you wouldn't mind sort of sharing your perspective on how we can better respond to some of our patients' needs through alternatives like that.
Sure, I'm starting to think that you and Steve read my notes, however.
Maybe.
Because access is what my notes start with, and it's all about obtaining access for our patients. And there's a severe shortage of mental health providers in our country. And at the top of that list is just a critical shortage of child and adolescent psychiatrists. If your child gets referred to a child and adolescent psychiatrist in this country, the typical wait is 6 to 12 months. And so can you imagine having a child with something like depression or anxiety or even ADHD and not being able to access a professional that can help you? I mean, it's really kind of scary, and we wouldn't accept that really with anything else. If your child had diabetes or a broken arm, you're going to wait 3 or 4 months for care. That just wouldn't happen. So it really is all about access and how we increase access for our patients. And as you mentioned, Katie, the Wall Street Journal article last week featured a program that I'm just blessed to administer through Mercy Virtual in St. Louis. And it's a collaborative program between Mercy Kids and Mercy Virtual, where we recognized that there were kids that just could not access care, mental health care. And so we knew that we couldn't hire our way out of this. There aren't enough child psychiatrists to hire. There's a severe shortage. And for most Springfieldians, they can't afford to go find a boutique practice and pay cash up front for their care. And so we decided that the best way to improve access was to train our primary care providers, our pediatricians and family practitioners, and then develop tools within our electronic health record. And then that allows those providers to be able to respond the very day that the child shows up in their office. Now, these folks aren't mental health experts, so how do we support them in doing that? My team at Mercy Virtual is available during the workday, 8 to 5, to help them in terms of an email question or a phone question. So in real time, our response time is 5 to 10 minutes. We're supporting our primary care providers everywhere, Arkansas, Oklahoma, and Missouri, anywhere that Mercy is, as they're treating these kids. And if there's a crisis, we sense that something has come up, that this child needs to be seen by an expert today, we do have the ability to camera in. But it's not a typical telemed process. Telepsychiatry or telemedicine only solves the distance problem. It does not address the shortage of provider problem. But having a team-based approach does. And so it's an excellent program. We've had a nice response from our pediatricians. Families love it. We have fewer kids heading to the ER because they can't get seen, fewer kids hospitalized unnecessarily. Parents miss less work, kids miss less school. It's a win-win. And so we really need to find similar programs that we can do for our adult populations as well. Mercy has 5 adult psychiatrists and 4 advanced practice nurses. We used to have 5 till CJ stole one last week, I think. But we need upstream solutions to prevent our patients seeking care in the emergency room or the inpatient setting, which is really the most expensive last place you want folks to be. So taking a collaborative approach is important. We have a couple of great collaborations. One is with Burrell. We've collaborated with them to come into Mercy and help us manage our inpatient unit, and that's awesome. I mean, it's going to be terrific for Springfield because there are some patients that really need the certified community behavioral health center approach, which Mercy can't offer, but Burrell can. And so now with that kind of collaboration, it's very similar to our collaboration with Missouri State and the Arc of the Ozarks for our autism treatment program. And so those are the type of solutions that we need to find. The old model, what I call it the confessional model, one patient, one psychiatrist, it's not sustainable. It's already broken. We can't rely on that because there aren't enough at that level. So we need a team-based approach using nurse practitioners, physician assistants, mental health specialists, therapists, led by a psychiatrist to go and take care of a population of patients in real time. And if we do that, what we're going to find is that we can increase access and decrease the downstream consequences of mental illness, which are significant.
Absolutely. And I think as a mom, and I know many of us are parents out in the room, I think those are the things that we want to hear, that when our children are going to need that access, that it is provided at that time. And I think it's an excellent example of the hopeful things that we have going on in our community. So I commend you for that work. CJ. So like Steve mentioned, CJ has brought an immense amount of effort and shift as far as access to care in our community with Burrell Behavioral Health. So I'd just like to ask you sort of generally, how are you addressing the mental health needs of our community at Burrell?
Yeah, thanks for having me. And by the way, thank you for 417. Thank you to be on this panel. And really, when we look at mental health issues, people often say, well, what's Burrell going to do about it? And the fact of the matter is, you're seeing what Burrell's doing about it. We're connecting with area health partners that are as motivated and passionate about behavioral health services as we are. I always like to just do a show of hands, and just bear with me late in the afternoon on a Friday. How many folks know somebody at church that struggles with a mental illness? And by the way, keep your hands up because I'm going to go through a series of questions. How many somebody at church? Okay, keep your hands up. How many folks out there are aware of somebody at work that struggles with a mental illness? How about somebody in your family that struggles with a mental illness? Yeah, so as you can see, it impacts almost every single person in the room. And I think we've already talked a little bit about it. One of our major initiatives of our team is to really look at access. And what does access mean? It's how quick you can get into care when you need it. So imagine if when your hand was up, if I also said to you, would you be patient enough to access care if you had to wait 4 months? Most of the hands would go down and you would go somewhere else, either outside the area or some other entity. And that cannot be acceptable to our community. It's not acceptable to our community. But we need to figure out a way, when you need mental health, that you can access it when you need it. And so one of the things I like to talk about publicly is we talk about how we really want to come up with a concept like Amazon Prime, where you are able to access mental health services, behavioral health services, when you need them, when you want them, and where you want to receive them. And internally, although I don't want to get in trouble with Amazon Prime, we call that Burrell Prime. And that's our philosophy internally. And so people have really been interested in how do we drive down those access times. And Steve is correct. We've taken our access times down to days, which means that if you call our main center today on the south side of town, unfortunately, you can get in immediately. But on the south side of town only covers the south side of town. And we need to make sure that we are wherever people need us. And in case you've noticed, there's also a north side of town, a west side of town, and an east side of town. But we look at access really in 3 ways. We look at how do we connect with the criminal justice community, the legal community, how do we connect with our healthcare partners, and how do we connect with local and area school districts. And so in the way of criminal justice, Chief Williams, I believe, is here somewhere. Burrell has trained and provided iPads for about 50 officers out in the field. So when they encounter somebody where they need us, when we're not there, when they encounter somebody in the field that struggles with a mental health issue, or an addictions issue, that officer can actually connect with a Burrell provider through an iPad. And that's offering access beyond our four walls. We have to, as the behavioral health industry, move away from waiting for people to walk through our doors for care. We need to go where they are. And in terms of the medical community, we do have a partnership with Mercy. We have a partnership with Jordan Valley. On the Mercy side, we also we mentioned providing services on the inpatient unit. We also provide services in the emergency department, so that when you go into the emergency department, you have the ability to see a Burrell provider right then and there rather than waiting till the next day. We also have partnerships with Cox and with folks embedded in their primary care offices, embedded in their pediatrician's office. So if you're a parent and you're concerned about a kid that has ADHD or depression or anxiety or suicide, rather than making that phone call to a Burrell, we actually have a provider based out of that office. And then hot off the news press, Burrell and SPS are getting ready to partner, and we're going to be providing a bunch of access sites throughout the entire school district to meet the behavioral health needs. The superintendent has been an extreme innovator. Mike Dawson, his right-hand man, have been phenomenal innovators and advocates for behavioral health services as schools see more and more issues with kids coming forward. Then parents already trust the schools. What a perfect place for an access site. So none of this really would have been possible without the additional funding. And I really want to, anytime I give an opportunity to thank Senator Blunt, I always want to thank Senator Blunt. If you haven't followed that, over the course of about 2 years ago, we've been able to change our ways in which organizations like Burrell get paid, which has made all these things possible. So it's truly been a team effort in our improvements in our city, which have been really strong area partners in some changes in reimbursement, and also a real passion to make sure we're meeting our mission.
Great, thank you. And it's clear, obviously, through all of these examples that many of the things that we have found through this process are starting to coalesce and align, and the collaboration has been one of the key factors within that, and that really is a testament to our community. One of the other sort of issues that would be we could unpack for quite some time would be the fact that throughout this collaboration, it has also helped us to really address the issue of stigma around mental health. But I think even looking into stigma and ways that we can help students and all of those other sectors of our community, one of the primary ways that we can engage with folks is at the workplace. And so I wanted to ask the panel and give you guys each a chance to sort of weigh in on what are those opportunities that you see that we as employers or employees can offer to our counterparts in the workplace when it comes to issues of mental health.
At Mercy, we recognize that mental illness is a burden to our coworkers as well as our patients. And so we've actually done some pretty innovative things. Mercy launched a zero suicide initiative across our ministry this past year. And so our goal is to drive suicide to zero among our patients and coworkers. And so it's a very kind of intensive program that includes education for providers, nurses, everybody, basically, including our patients. And in addition to that, we've started two programs, one called How's Your Five, and the other is called I'll Listen. And it's really targeted at our coworkers, kind of helping them to understand and make it okay for them to talk about their own mental health struggles, but also to be sensitive to those of their coworkers. And so we really want to, we know that coworkers who are struggling with mental illness have the same kind of disability that they do if they have under or untreated medical illness. And so when we can address it as this is part of health, providing you good health, it just makes a lot of sense, and it kind of opens up that door. It's okay to talk about it, and we've asked our providers to screen every patient for depression at their annual visit, and actually as part of our Zero Suicide Initiative, we screen for high-risk suicide at every single visit, regardless of whether you come in for your 16-year-old's acne or your high blood pressure. We're doing screening for that, and we do that for our patients, our coworkers, and even our doctors.
Good.
When they go to their appointments.
That's excellent.
I think CJ did a great job by just asking, and when you see how prevalent it is, it creates that greater understanding. And I think every effort we can to appreciate that, as we understand things better, we create more empathy, And with that empathy, we create action. And so there's a lot of great best practices that the hospitals are doing, the clinics are doing, that employers are doing. But creating that understanding to know that if 1 in 5 of us as adults are going to suffer, we need to be aware of it and know those early signs and be able to provide that kind of mental health first aid and then get them in the right place, because most of those suffering, or many that are suffering, are disinclined to get care, choose not to get care, don't have access to care. So having a mechanism in your businesses to make that available, make it comfortable, your job's not on the line, just no more than it would be online if you have heart disease. Right. To create that empathy, it makes it really a powerful message for our employees to understand.
Yeah, and I would add, we've really moved the dial in terms of our ability as a world to talk about mental health. I mean, case in point, I'm not so sure if this event's ever had a conversation around mental health issues. So I think the temperature and the climate is much different than it's been 2 or 3 years or so ago, and encourage more people to come forward and champion their stories. I think that's really important. We all have stories. Everyone in this auditorium has a story, and how can we create courage and create an environment and context for us to share each other's story? Even a place like Burrell Behavioral Health, we are the behavioral health expert in the community, and we went through a complete rebrand. If you ever get a chance to check out our website, our retooled website, we have a new logo. And it's a bee, and in the middle of the bee where the circles are, they're chat bubbles. And our new hashtag is, our new motto or tagline is time to chat. And what that really is it's in some ways we recognize how important and serious treatment is. But we also recognize that it's incumbent upon us to create an environment in our communities that people feel the permission to chat, that they feel the permission to talk. And so what we're really hoping to do is to develop a series for businesses in the area to really like a video series for you to understand, how is it that I create a mental health friendly workplace? Do I have an EAP program for behavioral health for starters? How do I handle discipline for somebody that has a mental illness? How do I encourage my coworkers to seek care? And then, can we get trained in mental health first aid? And I think those are really important. And I would take it a step further. Last year, we hired our first director of diversity and inclusion. And does your respective workplaces create a culture where you feel like everybody, regardless of color skin, regardless of religious background, regardless of whether they have a mental health issue or not, that they feel supported in the organization? How does management drive that culture all the way through all the individuals employed?
Absolutely. Those are excellent points. And I would encourage you all, mental health first aid has been mentioned a couple of times here. And we at the health department decided that through this process, we learned about the mental health first aid as a resource, and we trained all 110 of our employees. And I will tell you that we have had a significant shift in mindset on how we understand and approach and offer help to those who need it when the situation comes up, when they do want to chat. And so the community partnership of the Ozarks does offer trainings on a regular basis, and there's information out in the lobby, and I would encourage you, if you're interested, to go ahead and take part in that training. It offers a lot of valuable information. So, and with that, I will just say again, I think it's been mentioned many times, but having this conversation today, although it is challenging and sort of uncomfortable, it's a privilege to have the opportunity to talk about it and to normalize it and to make it about a chat. And so thank you again for the opportunity, and we look forward to, if you have any questions or you would like to engage in the process moving forward about how we continue to improve mental health in our community, we'll be out in the lobby for that. Thank you.